Hello everybody. Welcome to No1doctor channel. Today we will discuss one of the common surgical problems. Welcome doctor.
Welcome doctor for you and for your channel subscribers.
A 40-year male patient sustained abdominal trauma following a road traffic accident or assault and presented with pain in the right loin and hematuria. How will you manage?
Gross hematuria following abdominal trauma indicates urinary tract injury. General management will be according to a TLS protocol of management. Primary survey and resuscitation. Secondary survey. Definitive management. After primary survey and resuscitation, I will proceed with secondary survey. A detailed history and clinical examination is essential for diagnosis of the nature of injury. History details history about type of injury, time of injury. Hematuria, microscopic or gross hematuria. Progress, increasing or decreasing. Pain, details history about pain, site, character of pain, red. General examination. To assess the degree of shock, pulse, blood pressure, respiration and temperature. An examination from head to foot to exclude any other associated injury. Local examination of abdomen. Inspection, paranephric ecchymosis or bruising, abdominal distension, any swelling in the loin. Palpation, muscle guard, or rigidity, tenderness or any mass in the loin. Percussion, free fluid in abdomen ascertained by shifting dullness, obliteration of liver dullness suggesting free gas under the domes of diaphragm. Auscultation, bowel sounds may be absent in patients with hemiperitoneum or peritonitis. Rectal examination, any fluid collection or tenderness in the pelvis.
What investigations are helpful for diagnosis of renal trauma?
Urine examination for gross or microscopic hematuria. A contrast-enhanced CT scan is the investigation of choice. Assess functional status of the affected and the contralateral kidney. Extent of injury. Extravasation of the contrast. Vascular injuries. Other associated injuries. A single-shot intravenous urography is very helpful if there is no facility for CT scan. Demonstrate the normal functioning opposite kidney. Functional status of the injured kidney. Any diextravasation? Ultrasonography of abdomen. Demonstrate opposite normal kidney. Assessment of the injured kidney. Enlargement. Cortical tear or paranephric hematoma.
Doctor, what are the grades of renal injury?
The types of renal injury depending on the severity are: Grade 1, subcapsular non-expanding hematoma without parenchymal laceration. Grade 2, cortical laceration less than 1 cm of parenchymal depth, no urinary extravasation, contained perirenal hematoma. Grade 3, cortical laceration greater than 1 cm depth, no urinary extravasation. Grade 4, parenchymal laceration extending through the cortex, medulla and collecting ductal system with urinary extravasation. Grade 5, shattered kidney, avulsion of renal pedicle.
Doctor, what are the indications of conservative treatment for renal injuries?
90 to 95% of renal injuries can be managed conservatively. Patient hemodynamically stable. Hematuria is decreasing. Paranephric hematoma not increasing. No extravasation of contrast in CT scan. The components of conservative treatment are: bed rest, intravenous fluid and blood transfusion, analgesics, antibiotics, monitoring of patient pulse, blood pressure, serial urine examination, paranephric hematoma assessment.
Doctor, what are the indications of exploration for renal trauma?
Absolute indications: persistent renal bleeding, expanding or pulsatile perirenal hematoma. Relative indications: urinary extravasation, non-viable tissue, segmental arterial injury.
Doctor, how will you approach an injured kidney?
The transperitoneal approach is preferred to exclude other associated intra-abdominal injury and to have early control of the renal pedicle. The renal pedicle is dissected and an umbilical tape passed around the renal vessels to control hemorrhage once the dratef fascia is open.
Doctor, what should be the extent of surgery for renal trauma?
The idea in renal trauma is to conserve as much renal tissue as possible. In majority of cases, renorrhaphy is the treatment of choice except in grade 5 injury. For renorrhaphy, the kidney is exposed completely. All non-viable tissues are debrided. Hemostasis obtained with chromic Git sutures. Injured collecting system sutured. The cortical tear is repaired. The renal capsule is opposed. In cases with polar tear, a partial nephrectomy with removal of non-viable tissue, hemostasis, and closure of the collecting system. The area may be covered with an omental pedicle.
Doctor, what are the indications of nephrectomy in renal injuries?
Total nephrectomy is immediately indicated in extensive renal injuries when the patient's life would have been threatened by an attempted renal repair. Grade 5 injuries with shattered kidney may be treated by nephrectomy provided the other kidney is functioning normally.
Doctor, what are the complications of renal injury?
Persistent urinary extravasation may result in anurinoma, infection of a paranephric hematoma, paranephric abscess, delayed bleeding, hypertension due to renal vascular injury leading to stenosis of renal artery, compression of renal parenchyma by the extravasated blood or urine, post-trauma arteriovenous fistula, stimulation of renin-angiotensin axis by relative renal ischemia.
Thanks, Doctor.
Thanks for you and for your subscribers.
Thanks for watching. Hope to see you again in next videos. Do not forget to like and share our videos and subscribe to our YouTube channel No1doctor and share our videos with your friends on social media. With my best wishes.